So, our next session presents an incredible lineup of experts who will be discussing a very critical and timely issue: compliance challenges in African healthcare. Regulatory compliance is key to balancing innovation and safety in the fast evolving healthcare landscape. And it will be incredible to explore that with our distinguished panelists today. So, this session will be moderated by Chiozo Okadigbo, the Associate Director, Forensic, Deloitte and Touche. She will introduce the other panelists, guide the discussion, and ensure your questions are addressed. So Chiazo is a lawyer and chartered accountant with over 15 years of experience as a forensic professional. She leads the life sciences and healthcare industry for the financial advisory business of Deloitte Africa. She has advised clients on enhancing their compliance frameworks, managed and conducted complex forensic investigations, and provided advisory support to clients across West Africa, including Nigeria, Ghana, and Cote d'Ivoire, to help them drive organizational integrity. Prior to joining Deloitte, she had a brief stint running a forensic services consultancy firm focused on providing quality and efficient services to small and medium-scale businesses. So remember to please share your questions in the Q&A box throughout the session, and they'll be addressed by the moderator. So let's give a huge welcome to Chiazo to lead us into this panel session.
All right. Thank you very much, Vaidat, for the intro, and a warm welcome to everyone. For those who are just joining us, you're very much welcome. For those who have been with us, since we started, I hope you found this really useful and a good use of your time. So I will dive right in with a round of introductions for the panelists. I dare say it's a fantastic lineup of speakers that we have today. Rich, diverse experience. And I'll also encourage you, if you have any questions during the panel, please use the question icon button. That's the one that has the question mark in it, is on the third icon on your right. Please use it to ask questions. We would also like your engagement during the session. So there's a poll as well. We'll love to hear your thoughts. So first on the panel is the distinguished gentleman, the only gentleman on the panel, Mr. Remy Adesina. Mr. Remy Adesina is an exceptional pharmacist. He's a global health leader with over 3 decades of leadership, strategy, and operations experience, spanning across multiple continents. His career is nothing short of impressive. Currently, he's a global director at Salient Advisory, which is a global and digital health consulting firm. Prior to Salient, he made his mark in the health tech and pharma research sectors, whilst forging a brilliant career at various esteemed companies. Remy's influence is truly global, with a vast and deep network, particularly in the African context. He is a powerful convener of the 13-country regulatory learning group that brings together the heads of all the pharmacy regulatory agencies in Africa. He's a trusted advisor to government donors, life sciences industry companies, health tech companies, also to investors and innovators. He lends his expertise as a board member of various companies and organizations. So whether he's jet setting across continents or shaping health policies or driving innovation in health tech, one thing is for sure: Remy is a dynamic force to be reckoned with. Next up on the panel, I have Dr. Maurice Atoki. Dr. Maurice Atoki is the CEO of the Africa Business Coalition for Health. This is a not-for-profit social enterprise, which is a coalition of African business leaders and other critical stakeholders who are all banding together to give the continent's healthcare sector the much-needed boost. Dr. Maurice is also the go-to facilitator for health policy at the Nigerian Economic Summit Group, the NESG. She's seen firsthand the potential of public-private partnerships to transform the health sector. So today she comes armed with experience and deep understanding of the quirks and the challenges that come with this kinds of collaborations. So very much welcome, Dr. Maurice. Glad to have you. And next up, we have Carrie Britton with an impressive 25-year proficiency in regulatory, clinical market access strategies for both US and global markets. Carrie's expertise extends to commercializing medical products through all the development phases. In her previous roles, she had skillfully led global clinical research and regulatory teams. As a top-tier regulatory affairs leader, she has recorded success in bringing medical devices to market by guiding the process from concept to regulatory approvals. I dare say that Carrie's superpower is navigating the complex regulatory landscape for AI-driven and digital healthcare solutions, whilst ensuring compliance with the US and EU software regulations, which are very stringent. You will agree with me. Our experience demonstrates that innovation and compliance do go hand in hand. They're not mutually exclusive. So whip out your writing materials, because I have mine, and get ready for some fantastic tips from Carrie on advancing innovative healthcare that boosts, patient outcomes while still staying compliant. So very welcome, Carrie. It's lovely to have you. I have Nomfundo Kabela also on the panel. Nomfundo is a healthcare visionary with over 20 years of impactful experience in SA and Sub-Saharan Africa, particularly in the pharma and health tech scenes. She's fired up about revolutionizing health and well-being across Africa in ways that are cost-effective and sustainable. So get ready to be inspired by Nomfundo as she shares her insight on value-based healthcare, focusing on how it can be applied in African settings. She will also delve into medical ethics and emphasizing the importance of upholding patient dignity and autonomy in healthcare delivery. Very warm welcome to you, Nomfundo. It's a pleasure to have you. So I think those are the panelists I have available. I know we are also supposed to have Rabiatu, but maybe I'll just introduce Rabiatu as well, but I see that she's not here with us yet. So Rabiatu is a program director at RAES, where she spearheads groundbreaking initiatives in health, gender equality, and civic participation. She's very focused on improving public health outcomes through digital innovation. Through the flagship program of RAACS, which is CELAVI, CLV for short, RAES is transforming sexual and reproductive health in West Africa and breaking barriers for marginalized populations through the implementation of its cutting-edge digital solutions. So she has a lot of experience in that area, and she'll be sharing her nuggets of wisdom on leveraging culturally adapted content through digital platforms to tackle public healthcare challenges. So here's a fantastic lineup of speakers that we have today. And I'm very glad to be talking with, this very fantastic crew. And I invite you to sit back, relax, soak in all the experience, and we'll very much love to hear your thoughts. So please engage using the poll and the questions. You're welcome once again. So to kick off the panel, Dr. Otoke, I'm going to be starting with you. So in your experience, what are the primary compliance challenges faced by healthcare innovators in Africa? And how do these challenges impact scalability and adoption of new technologies?
Hi, everyone, and thanks, Chiazo. I must start by apologizing. I think I had some technical glitches that threw me out at some point. Can you all hear me, please?
Yes.
So, right, and thank you for the question. I mean, a good place to start is to first of all consider as a challenge what we all know as a fragmented regulatory landscape. So all across Africa, there's no unified framework that specifically addresses artificial intelligence in healthcare. And even every other non-digital technology that has been introduced to healthcare and has been used And instead of that, various countries across the continent rely on ancillary legal frameworks related to data protection, related to consumer rights and digital health. All of these are neither comprehensive or harmonized or sufficient to replace, regulatory standards. Now, what happens is that this level of inconsistency complicates the regulatory process for innovators trying to scale their technologies across countries, across borders. So, for example, countries like South Africa, countries like Kenya, Uganda, they've initiated basic guidelines for AI in medical devices, and these frameworks are not universally applied. What happens is that there are gaps. Gaps are created that impede regional collaboration and also trust in artificial intelligence systems. It also slows down the scalability of innovations and limits the potential to transform healthcare delivery across the continent. You also want to consider things like data privacy and protection, also representing a very significant, um, posing significant challenges. So AI technologies rely on vast data sets, including sensitive personal and medical information. So if we look at Nigeria, where we are, if we look at South Africa, if we look at Kenya, they've implemented data protection laws. Enforcement mechanisms remain quite weak when we look at data protection. We've not really heard much of anyone whose data privacy has been infringed upon, and it became a big case in these parts of the world. Additionally, the absence of robust frameworks of cross-border data sharing restricts collaborative opportunities that are essential for this level of innovation that we're talking about. Another challenge are inconsistent policies. And I think inconsistent policies really comes from the lack of, safe to say, knowledge at the level that it matters in leadership across the continent. So again, you will have inconsistent policies on obtaining informed consent or making informed decisions because there isn't really enough effort to really make technology the order of governance, particularly in electronic format. So further, this hinders health research, it hinders deployment of solutions digitally and otherwise. Again, you want to think about consumer protection and liability issues that create additional obstacles. Traditional liability frameworks struggling to address the complexities introduced by artificial intelligence systems, causing harm from algorithms, errors, rather than human fault. So in countries like Rwanda and South Africa, consumer protection laws offer some provision, such as strict product liability, but these are absent in many other jurisdictions on the continent. So again, if we're talking about Africa, we need to really highly consider the lack of scalability of some of the solutions. Just, I don't know, do I have more time? Should I go on?
Yeah, I mean, Dr. Morris, one thought that crossed my mind as you were speaking was, do we really have hope? It seems like we have a lot of hurdles that we need to jump over, right? But thank you so much for those contributions and very valid points as well.
You're very welcome.
Yeah. So
Absolutely.
I would go on to Mr. Adesion. This next question is for you, right? When you think about Africa, because obviously you have quite a bit of experience working across Africa, what are the unique regulatory challenges that face Africa when compared to other regions, which you also have experience, working in as well? So for healthcare innovation, when you compare Africa and other climes, what are the unique challenges that we face here in Africa?
Hello to colleagues on the panel.
That was one challenge right there.
Can you hear me now?
Yes, we can hear you, Mr. Adesion.
Okay. I was just thanking you for having me on this distinguished panel and saying hello to my fellow panelists, and most especially to those who are joining us on this session. To respond to your question, I'd like to do a bit of context setting so that we can know how vast the topic is and why I'll choose to narrow my perspective to a certain part of it. So digital transformation, as it were, can apply across the entire health value chain. So one place that is useful to start in picturing what the issues are with digital health on the continent is to use the WHO Health Systems Building Blocks approach. So when we're talking about digital, we know we can have digital applications in the governance, which is where regulation fits in. And we know that governance superintends over things like service delivery, over things like the financing of the health systems and how the insurance links up, over things like the medicines and the vaccines and the technologies that form a block on their own, and other things like human resources for health and stuff. So when you take it from that angle, you see how much of a big elephant this is to tackle. And so I will lean a little to my field of specialty, which is in the pharmaceutical space, and how innovation in that space through digitalization of the health supply chains is something. So when we look at what are the unique challenges that digital health innovation faces, it will be from the lens of that health product supply chain. As Dr. Toki mentioned, fragmentation is the first thing that encounters an innovator. For all the 54 countries that we have in Africa, just imagine that there are 54 different regulatory requirements for innovators who want to increase users' access to health products. So that in itself becomes a barrier, because one of the things about digital health and technology in general is that it benefits from investments. Venture capital has been one of the driving blocks of investment in digital technology, not just in health, but across the spectrum. And so when investors and innovators have to contend with 54 different entities, that becomes a huge challenge. And that's why the leadership role that the African CDC is playing in bringing together some kind of regulatory sandbox and creating vetted healthcare marketplace that looks through these innovations and allows countries to come to that platform to, test some of the innovation in their various unique systems using a sandbox approach, where the regulators and the innovators can co-create the environment that maintains the benefits of the innovations, but at the same time safeguards the user safety and all of those things. So that's one major issue. When I narrow down a little more to what did we find at Salient Advisory, one of our strong points or strong areas of practice is taking a longitudinal approach, looking over the years at subjects of interest. And we looked at the regulatory landscape for online pharmacy as an example in Africa. We focused on 13 countries, 9 Francophone countries, and 4 Anglophone countries who agreed to come together under a group I lead called the Regulatory Leaders Regulatory Learning Group. And what we found is that there's distinction between the level of maturity of the Francophone, innovative space with respect to online pharmacy. And that's closely related to France itself, which is not a big proponent of online pharmacy. If you contrast that with Nigeria, Ghana, Rwanda, and Kenya, when we started this regulatory learning group as at 2021, none of these countries had any clear regulation on how online pharmacies were to operate. But fast forward with the group learning that has happened on that platform and the efforts of the various regulators in that sector, we have all 4, Ghana, Kenya, Nigeria, and Rwanda, now having published laws. This makes things easier because it allows innovators and investors to understand what the landscape is, what can be done and what cannot be done. But that's just the rudimentary stage. The next phase of that is, are these regulations themselves fit for purpose? And we took an example of one of the countries. Because of the trust that had been built on this learning group, they allowed us to come in to review the regulations they had put out to the public and signed into law. Not into law, as a regulation, gazetted as a regulation. I'll keep the country confidential. That trust allowed them to follow our guidance that regulations and laws are best co-created with the innovators, with the stakeholders who will be affected by those regulations, and we did a comprehensive review. I'll end on one point. There was a conflict, similar to what Dr. Atoki said, conflicting policies. So imagine that you're trying to promote digital innovation to improve access to products. And at the same time, one of the major digital planks, telemedicine, you say that a prescription coming out from a telemedicine consultation will not be eligible to be served on an online pharmacy. You see that that's a huge contradiction because they're working across purposes. But through the trusting environment we had created, we asked the regulator why that conflict existed. And it was very interesting to find out that it's not as if they didn't know it was conflicting, but because there were concerns about how do you validate a prescription that is generated through a telemedicine encounter, because on that one as well, there are no laws, no regulations yet on telemedicine. So we were able to address that concern and modify that regulation in a way that met the safety considerations as well as kept the innovative, approach that presented. So those are some of the challenges that I see that are a little bit unique in Africa. That's regional block distinction between Francophone lagging behind. There's also the challenge of limited regulatory capacity. So as you would know, regulation typically follows innovation. Innovation usually is ahead of regulation. And it takes a lot for regulators who are contending with existing brick and mortar challenges to rise to that level of competencies. Number one, they don't have specialized staff. So while the resources they have are limited for even the current job, that's a challenge. And one of the things we help to do is to bring, regulators from advanced countries to work together with these African regulators. And that's made a difference in terms of capacity building.
Very much, Mr. Adesina. Very, very useful contributions right there. So I guess we will go right over to Carrie. Carrie, this question is for you. So when you look at recent times, there's been a lot of rapid advancements in digital health and telemedicine. One key question, and I think that came out of the example that Mr. Adesina used, how can African healthcare regulators ensure patient safety without stifling innovation? I think this one question, on the minds of regulators. How do we make sure this can be used? And at the same time, how do we make sure that the patients, are safe as well?
Morning, afternoon, right? African healthcare regulators, I believe, can balance patient safety with innovation by adopting a few key strategies. First would be flexible regulatory frameworks. By implementing adaptive and flexible regulatory frameworks that evolve with technological advancements. This means that by creating guidelines that accommodate new innovations with maintaining rigorous safety standards. A second, again, would be collaborative approaches. Engaging in continuous dialogue with technological and technology developers, healthcare providers, and other stakeholders to understand innovations and their implications. This collaboration would ensure that real-world insight informs regulations that support safe and effective technology deployment. Another, I believe, would be sandbox environments. This would establish regulatory sandbox environments where technologies can be tested in a controlled environment, in controlled real-world setting. This would allow for assessing safety and efficacy without the immediate pressure for regulatory compliance and promoting innovation with safeguarding patient welfare. Another would be capacity building, I believe, where investing in training, education of regulatory staff to keep pace with technological advancements. By enhancing regulatory capacities, I think they could better assess and approve innovative solutions in a timely and safe manner.
Much, Carrie. Very useful points right there. So you've talked about what the regulators can do, right? I will hand this over to Dr. Morris, just to get a sense of, we've heard about what the regulators can do. What do you then think the healthcare companies and startups can do to proactively address compliance issues? Because we all realize that there are problems, there are issues that needs to be dealt with. What can the players then do to ensure that they address compliance issues and at the same time they're not stifling innovation as well? And especially, Dr. Morris, when they're developing products for the underserved populations.
All right, absolutely. And I like the last part of your question because it does bring, a bit more context. First and foremost is to highly, and perhaps this is even a level of pleading to all innovators, to really localize their mindset. So one of the biggest ways of, really playing and being proactive, especially startups in this sector, is to adopt a multifaceted approach that integrates strategic planning, stakeholder engagement, sustainability at the back of your mind, and a lot of collaboration through public-private partnerships. The last one is also, for me, and I feel very strongly about this, is to ensure that innovators consider themselves also as pioneers. And as pioneers, it's not, in very many cases, it will not be, really convenient. Pioneers break ground, they break new ground, and they break barriers. What it means is that you are developing an industry. So you must have targeted initiatives combined with strategic regulatory reforms, public-private. You must be ready to partner with the public sector, no matter how, far away it seems. And also really understand that you're in a terrain, you understand your local terrain on a country-by-country basis. Now, on my part, another angle to your question, Chezo, is another foundational step for companies is to build compliance into their design and development process as they build solutions. And this includes conducting thorough regulatory assessments early at the innovation lifecycle so that you earmark relevant legal requirements. So again, I've been with a group that because of the missing legal requirements, and so this is a multi-country team, because of the absent legal requirements that we have in this part of the country, the project will not go on. And so things around data protection, things around the regulatory and legal requirements, informed consents and licensing, when they are missing, you must ask questions. You must be bold enough as pioneers to take the lead, and lobby for your sector. That's one thing that I find missing. Again, maybe because there's a lot of young people, they think they're not mature. If you're mature enough to play in a sector that is breaking new grounds, then you must know that you need to be talking to the big boys. You need to be engaging government. You need to ensure that regulatory framework is in place. Embedding regulatory considerations from the start reduces the risk of things around non-compliance later. And even when you're cross-bordering, when you have cross-border transactions, you must be enlightened enough to require what the regulatory stands in your respective countries and the country that you're dealing with really are, while ensuring that the solution is adaptable, of course, to legal nuances in different jurisdictions. Again, startups must design their AI systems with privacy-preserving algorithms to ensure that telemedicine platform meets country-specific electronic consent standards, if it exists. Again, all of these are missing in Africa, but somewhere along the line it's going to happen. Chezo, you asked whether we have hope. Of course there is hope. You remember that we're also in a global community. COVID-19 showed us that we're all in a cycle. And if you think it's not going to happen, think again. It's going to come. It might be slow, but it's because it has to come. And so it's just really making sure that everyone, whether established companies or startups, are ready and they're open enough in terms of horizon to embrace all of these standards when they eventually come. Again, things around prioritizing transparency and accountability, even though they are not, being compliance driven right now, in data collection and processing must be priority to all of these companies, and so on and so forth. So I hear your voice, and I know that you're kind of rounding me up.
Thank you very much, Dr.
So over
Morris.
to you.
I when you speak, I sense that you're passionate about this conversation, then, and there's a whole lot that you want to say. But one thing I took away from the contribution you just made was compliance by design, right? So in designing those products, you need to build in compliance into it, and I think that's a very, very powerful thing. So for me, I will go right over, and maybe it's also a good time to welcome Rabiatu. Rabiatu, welcome. We missed you at the beginning, but thankfully you're here now, and it's a pleasure to have you. Okay, so the next question, I will go right over to Namfundo. Namfundo, this question is for you. So in the use of digital health tools, right, what role should patient consent play? And how can compliance frameworks ensure that patients fully understand and agree to the use of their data?
Chiazo, thank you so much for the question, and it's great being on this platform. I think we need to understand that patient consent must be the cornerstone of any digital health implementation. It can't merely just be a checkbox exercise. And more especially so in the African context, given the history of, mistrust between African communities in the healthcare sector. And that is off the back of, historical medical exploitation, non-consensual research, such as unauthorized clinical trials that typically happen during colonial periods. So, patient consent really helps to restore patient dignity and upholds patient autonomy. So, another kind of area that patient consent helps to cover is the undeniable existence of a traditional healthcare system throughout the continent. Many patients simultaneously engage with the traditional healthcare sector as well as with Western healthcare systems. And digital health tools need to navigate, these dual healthcare realities, and to do it sensitively. Another challenge that we're facing on the continent is data infrastructure challenges. Given the emerging nature of our digital infrastructure, patient data might need to, be stored in servers outside of the national boundaries or borders. So, for instance, a digital health platform in one country may have or may process their data in servers that sit outside of that country in another country on the continent or off the continent in its entirety. So it's important to understand who owns the data and what are the data flows, and for patients to understand that when giving consent. Another key thing to keep in mind is, because we're African, we're communal. There's a moral theory in bioethics called Afro-communitarianism, which speaks to the fact that we are communal as African people. And that being the case, we need to bear in mind when looking at patient consent, we need to take the family or the community into mind when patients are making medical decisions, because a lot of these decisions are community-based versus individual-based. And so patient consent, and particularly digital consent frameworks, must account for the fact that there might be a community, of people who are having to make a decision. There's also limited digital literacy. I mean, let's be honest. So there is a real risk of patients agreeing to data uses that aren't fully understood. So, kind of summing up, what I want everybody to walk away with regards to the importance of keeping ethics in mind when we're looking at consent is that the real role of patient consent is really about data transparency. Patients need to be clear about how their health data will be used, stored, and shared. And there's a couple of frameworks that are involved there. There's dynamic consent models that allow patients to modify their preferences over time, which is important because we change our minds, we're human. Clear communication of data usage in local languages, regular audits to ensure that consent processes remain effective and relevant, training for healthcare workers to be able to explain digital health tools and data sharing in culturally appropriate ways. So summing up, that really is, or those really are the things that we need to bear in mind when looking at patient consent in the context of digitizing healthcare.
Thank you very much, Nomfundo. Very, very useful and helpful points. It did shine through that you're doing a lot of work in the African context, right? Because you talked about a lot of nuances and considerations that one needs to take, into consideration when working within the African continent. So the next question is for you, Rabiatu. Welcome once again. From your experience, what are the most effective social and behavioral change approaches that enhance patients' ability and trust to understand and engage with or even consent to the use of their data? So what are those social and behavioral changes that really help with this in your experience?
Thank you so much, Siazo, and all the panelists. Really grateful to assist to this conference. And this question is really important for Africa because today we are faced to an increase on digital tool use. In West and Central Africa, for example, we have around 30% of young people aged from 15 to 35 who use this digital tools. So it's important to involve them. As Nomfundo said, the patient consent is fundamental in the use of digital health tools, ensuring ethical data use and compliance. So giving them the power to control their own information is capital, because we are faced with a population who is aware now about the data and how this data could be used to have other values in other contexts. So in this case, what we could bring is that involving them is important, but this starts by conducting research to see what are the needs in terms of information regarding their data, and what is the influencer in the community who could influence them, talk about the importance of the data, who could improve the health strategy, the policy in the next years. So conducting research to know what is the worries, what is the influencer around them, and what is the habit in using these tools is really important. So to reinforce the trust, what we learn from one of our program named C'est la Vie is that we we conduct a research, and we identify that a peer-to-peer influence is really powerful to share information with them and create trust, connect to them. So what we use is that we work with local peer-to-peer, local young people aged from 13 to 18, to 35, and we implement a digital campaign. And we reach around 12 million on the Facebook, Instagram, TikTok, YouTube, to say this is why we give them information regarding their health and the importance to use this platform, and also make a sensibilization to say your data is important to improve your health in the next coming month, because this could help policymaker or a service delivery decision maker to improve the tools, to improve the strategy, and to better integrate your needs and be human-centered design. So peer-to-peer influence is really good. And I think the weaknesses that we have, the area that we could improve today, is that to connect these digital partners in offer service with the local community. and to build together a campaign, a digital campaign or community campaign, which mobilize young people or mobilize just adults in the community to discuss with this the individuals who use, so they could trust, understand, and be really informed on it, and then we could get the appropriation. A peer-to-peer.
Okay. Thank you very much, Rabiatu. So sorry about the internet issues, but you know what she was saying just reminded me of part of the quote. When you involve me in the learning process, I actually learn. So the quote starts by saying, "Tell me, I forget; teach me, I remember; but involve me, and I learn." And I think that's one beautiful thing I loved about the peer-to-peer involvement, involving the people that you're trying to reach in the process, and it does help yield positive results. Thank you very much, Rabiatu. So just to mention, to us on the call as well, you can put in your questions in the chat. That's the icon that has the question mark, and also the poll is open. So please feel free to go in there when you have the time and share your thoughts with us. We'll love to hear what you think. Thank you very much. So the next question will be going back to Carrie. So Carrie, I'm coming back to you.
Sorry, I just got a problem with the platform, but
yes, we imagine so. But thank you very much for your contributions. Yeah. So Carrie, how are there specific technologies, based on your experience, that could simplify compliance reporting for healthcare players in Africa?
Okay, which one did we go to? Did we jump around?
Okay, so let me go over that again.
Okay.
Yes. So which of and this is 3A.
Okay, thank you.
This is 12 rather. What specific technologies can simplify compliance reporting for healthcare players or smaller healthcare facilities?
There are, now look at me jump around because we went to the wrong one. I apologize. There are several platforms that can help companies. So there are automatic data collection tools that can help companies organize their patient data, reducing manual effort and minimizing errors, which can help accurate, timely reports. There's real-time monitoring tools that are available to implement real-time monitoring systems for healthcare providers to track compliance and metrics, to help them also enable proactive management and quicker response to potential issues. There's also standardized reporting digital platforms that help you standardize procedures to help it easier for healthcare providers to generate consistent compliant reports. There's also analytical dashboards that are available for providers to issue compliant trends to help you with applying areas that need additional areas for support and informed decision-making. These are digital solutions for healthcare providers. There's also a bunch of platforms that are available out there for mobile health apps. So there are mHealth apps that can help for data entry for reports. such as ComCare, M-Track. Are these available in Africa? I'm not sure if you guys have heard of such. They're not necessarily cost effective for healthcare providers. There are some open access ones that are free to providers that you are available to get to for healthcare providers that are out there that are open access, but you are the problem is that it does put your patient's information out there at risk, which you don't necessarily want to put, that out there. There are also healthcare compliance software, tools like ComplyTrack, Smart Compliance that help automate compliance management and track regulatory changes. There's Greenlight Guru. They do a lot of, have you guys heard of Greenlight Guru or QServe or Compliance Track? They are regulatory quality system management for software, quality system for document control management systems for your quality management system that'll help you track managing your change reports, your quality control system, so you can do all of your design history changes, your DMRs, your batch control records. These solutions are practical and useful for small factories, but they may lack what is needed for an undedicated compliance staff. There's also robotic processing automation, so RPAs that can automate repetitive tasks such as data entry, report generation, freeing up your staff to focus on patients. And these are companies like UiPath, which offer RPA systems that can be tailored to healthcare company compliance needs. And then there's integrated compliance platforms like VigiFlow or AmpiFund, which offer comprehensive compliance management tools that offer real-time monitoring, risk management, and audit preparation. These can benefit small facilities providing stop solutions and compliance needs. These are just a few that can offer regulatory supports without overburdening limited resources. There's also other ones that cost, every time you implement a new source, you have to verify and validate the digital source of it, and they cost like hundreds of thousands of dollars per module you implement, and they're not just cost effective. So I don't know if any of the other panelists have other.
Yeah, thanks, Carrie. I mean, I could just provide some complementary ideas. So think of startups, and as previous speakers have said, the limited capacity outside of their core innovation and technology skills, right?
Right.
So a lot of these competencies can be difficult to acquire directly by those startups. And that's why the same way CFAs exist, the same way tech lawyers exist to advise startups, that's how you have regulatory tech advisors. So in Nigeria, for instance, I know of one, Infinity Health Systems. And what they do is to provide that capacity and representation to help startups, manage their compliance issues, because they are recognized by the national regulatory authorities for medicines, for instance. And there's also the more system-wide approaches. In the medicines area, for instance, GS1 standards is a global standard that is used, and Nigeria through NAFDAC is leading that initiative. So it simplifies the process when it's implemented, and it allows to pick up things on product authenticity and many of those kind of issues. So that complement of industry-wide support through regulatory platforms and engaging regulatory tech consultants to support these startups could be useful.
In the U.S., we're 21 CFR 820, which is globally now turning to ISO 13485, which is the rest of the world in MedSAP. So a lot of companies are paper-based when they're small, but it's a pain. And then we have electronic systems, which, it's not cost effective to go electronic. But yet then you have to be 21 CFR Part 11 or Annex 11 if you're in the EU. And so trying to globalize and harmonize all this, it's expensive for small startups, and it's not economical. And then there's all these the electronic systems there's some small ones, but then like when I was at Emergo, it's not cheap to go and get a quality system, and the global ones and to get it harmonized and then with the privacy and security and regulatory compliance and IP and the GDPRs, and everybody wants their hands in it, don't they?
Yes, I imagine so. But I mean, it's a real challenge, the limited funding that these startups have to deal with. So I guess one thing then will be to think out of the box. It can be, the solution can just be what we're used to. We need to be able to think out of the box. How do we work around this and still make sure we do this right? So thank you very much, Carrie and Mr. Adesina, for that contribution. So Nomfundo, the next question is for you, and I'll just be going back a bit around consent models that can improve transparency and patient trust. I know you started talking about it, a little bit when you spoke the last time. Maybe you can just take us through what are these consent models that can improve transparency and patient trust.
Thanks again, Chiazo. So, I mean, there's two distinct ones that come out, and they really do support that migration away from, the traditional paper-based consent systems that we see throughout the continent. So the first of the two is a stepped consent model, which offers an appealing theoretical framework, essentially, as it says, let's break down consent into manageable phases, because you can imagine for somebody like my grandmother who's from rural South Africa, for her to understand, patient data path flows beyond her and her doctor now into, then it's crossing borders and it belongs to this person. It's really, really difficult. So the stepped consent model says, let's break it down into meaningful or manageable phases. Level 1 could be something like basic health record access. Let me just give you consent to have my information on your system. The second one could be data sharing between my immediate care team. So not only does my physician have my information, but perhaps my endocrinologist, if I'm a diabetic, has it, and potentially my diabetic, my podiatrist, as well as my dietitian. The third phase could be anonymous data use for research, and obviously that takes more time and explanation. What's research? Why is it anonymized, etc. Then the fourth level could be something along the lines of integration with other healthcare systems. So that's the one digital consent model. The second one, and it's seeing quite a lot of success given the digital era that we live in, is with interactive digital consent platforms. And they leverage things like voice explanations in local languages, visual aids with infographics, simple verification questions to ensure understanding, and also areas where potentially you could use something like a QR code that links to detailed sources of information. But I think all in all, what's essential to take away or to understand is that digital solutions are there to complement and not replace that human interaction. The trust relationship between healthcare providers and patients remains crucial. So that's my summarized answer to that.
Very much, Nomfundo. Really useful points. Okay, Rabiato, I see you have your hand up.
Just what I want to add is that we need to make innovation in the elaboration of this on this consent tool. Like we could just elaborate it, but in the phase of elaboration, the thing is to be human-centered design too. to see how we could create this with the community, with the population who are using this. Because we could create it with the leaders, identify them and include them, because the leaders will represent the community. So in this, we have, I think, to make innovation, and we could not continue to having the same thing, the same process of producing this consent model. And we are going in the world who will be, I think, 100% digital tomorrow. So it's important to think about this and to see how to be human-centered design in this step. Thank you so much.
And if I could just add, Chiazo, there's a specific context, and it draws from Nomfundo's base in South Africa. There is an Aviro Pocket Clinic. They're innovators, and what they do is to provide a platform that incorporates the e-consent for patients and also is able to use AI to do the language translations. So like Nomfundo said, for folks in the rural areas who might be more comfortable in specific languages, there are AI plugins that allow that to happen. And this is something that is in a web form, so it's easy to access. The mobile versions, and it's just an example of the kind of solutions that innovators come up with to help deal with these emerging issues like patient consent and simplifying, and also getting trust of the users. And one of the things I also encourage is that in using that phrase patient, which is usually the health system's application to sick people, with the transition into wellness, framing might consider using words like users, consumers, and not just those who are sick and seeking remedial treatment. There are also the proactive aspects as well to consider.
All right, Chiazo.
Yes, please.
I wanted to also chime in, just so that we don't also lose sight of corporate governance and what corporate governance represents in all of these startups as they evolve into really requiring regulatory frameworks that will work for them. I believe strongly that there must be some compelling reason beyond compliance that positions the startups to have very solid corporate structures. It's only when that is in place that the burden, or just really having best practice at the back of your mind, compels you to also require for standards that you are expected to adhere to. And it doesn't come easy. I do recall that Remy mentioned the category of players, really. I mean, some of these guys are so tech, most of these innovators, that all of these things we're talking about don't come, primarily to them. But again, they are the ones that want the industry to grow, and they're really the bulk part of this industry. And so there has to be decisive building of capacity around some of these soft nuances to enhance their capacity to understand corporate governance and to understand the role that regulators and regulation plays in the industry, that they're all in. I think that's missing, and it's also because there's no burden on maybe government, jurisdictions, or really the players themselves. Nobody is championing all of these causes. And so for me, I do believe that the burden really right now are those who are positioned to make profits and make impact in the industry. And those are the startups. Those are the pioneers. Those are the entrepreneurs. The burden is on them to ensure that all of these are in place, that they get the right capacity. They understand what best practice in their industry mean. And they're also ahead of the curve. They're, getting information and building capacity from the global community to bring into the context of local and ensure that it works. Over.
Thank you very much. Very, very useful contributions all around. Much appreciated. So I think we have a bit of time for one more. I do not see any questions in the box yet. Please just give me. Yeah, so I would assume that everything it's clear, because I mean our panelists have been very, very detailed and clearly they are knowledgeable in the matters we're discussing today. So the next question I'll be taking will be going to Rabiatu. Rabiatu, is it possible to balance innovation and compliance? And if yes, what does this look like?
Thank you so much, Shiazu. I think, as we said here, following every time rules kill innovation. And through innovation, we could really improve health and save life. So I think balancing innovation and compliance is very important, especially in a program about health. I understand that we have also industry, and we need to make today connection between industry, regulator, and patient through human-centered design again. So for example, health program last week conducted, having this balance ensure that we can create new and effective solution while still respecting ethical rules, law, and cultural value. This is important to take also in consideration. For example, for one of our program in health, working with industry and other actors in the region, we design tools like a chatbot to help young people access health services while protecting the privacy and following strict data protection rules. But we are doing that in working closely with with a partner like Dimagi and other university based in Africa and based also in London or in California. So this helps us to ensure that our solutions are tested and meet local and international standard, and it helps us really for to obtain the validation of a ethical committee. So in practical terms, this balancing means creating tools that solve real problems in the community, in our population, like the chatbot, while making sure that personal information is secure and regulatory requirements are met. By involving researcher again, because we have university, we have researcher on today in the country or in Africa or in the worldwide. So involving them and connecting them to the regulatory bodies and the user in the process. We ensure that the solutions are transparent and met everyone's needs. So for me, balancing innovation and compliance is just not following rules, but it's about creating tools that are effective, ethical, and can have a lasting positive impact in the field of digital health. But for to be successful, we have to connect industry, regulator, and patient through human-centered design again. Thank you so much.
Very much, Rabiatu. We'll be wrapping up with the next question and looking at the results of the poll. I mean, all of you spoke loudly and we hear it. It is clearly linked to the next question we want to wrap up with. And after Dr. Addition, I'll invite, all the other panelists to also pitch in if they want to. So, Mr. Addition, how can African regulators and healthcare innovators or startups, right, work together to create a more supportive regulatory framework, given the issues that we've talked about? Because even in the polls, the top 3 challenges that people face in balancing innovation and compliance has a touch point with regulatory issues. So how can regulators and healthcare organizations come together and create a more supportive regulatory framework?
Thank you very much. In answering that question, allow me to use one slide that integrates the viewpoints that I have, and is an example coming out of Ghana, where they've introduced a national electronic pharmacy platform for the distribution of medicines. So if I may, step 1, step 2, and please let me know if you are able to see my screen, and excuse, are you able to see my screen?
Yeah.
Can you see my screen?
Yes, I can.
Excellent. So I want to use this example of Ghana, which, like many other African countries, had no regulatory framework for online pharmacy, the example I chose earlier. And as of 2021, they decided to underpin their electronic pharmacy policy based on existing laws, which is a shortcut to the long process that creating a new law can cause. And so with this electronic policy, at the heart of it is a centralized national platform that seeks to connect patients to providers being pharmacies and clinics and hospitals. But what is most important about this is how it brings everybody to the table, both the patient that has insurance, and Ghana is one of the leading countries in Africa with over 40% of their population covered by insurance, unlike Nigeria that has less than 10%. As an example, I think Ghana, South Africa, Rwanda, those are the leaders in terms of the universal health coverage approach. So the platform allows the patients to come on board and have that flexibility to choose the providers that they would like to access. So think of it as like an Uber for medicines, where vetted providers are being onboarded, and a prescription generated for a patient comes onto that platform, and by algorithm of where the patient is located, it is distributed to the nearest providers, pharmacies around that area, and the pharmacy that clicks to serve it is then able to provide the finalized distribution, delivering at the last mile to that patient. What enables and underpins this is a comprehensive digital infrastructure, public infrastructure, starting from identity management. So the unique national identification serves as the entry point, connection with the various financial services providers, the different cards that the banks issue, and all the credit cards, any form of, and even the money transfers that are very popular in those areas, you know. And it serves as a one-stop shop also for the regulators. So not just the Pharmacy Council that hosts the platform, but also the Food and Drug Administration, the FDA. So only products that are licensed for use by the NAFDAC equivalent in Ghana, FDA, will be on that platform. So it covers at the same time issues of substandard and falsified medicines. And it also allows insurers, the big insurers, both the government insurers and private HMOs, to be, you know, connected to these, and insist that this efficient process becomes the model through which their patients access claims for reimbursement of their care. And the final piece of it is that even the non-clinical service providers like logistics partners get vetted. So only vehicles that meet standards that allow medicines to be transported in ideal conditions and therefore retain their potency when they get to the user are permitted. Training for those logistics partners is ongoing. And so this kind of integrated approach gives that enablement to the patient, connects the providers, and allows for integrated public infrastructure to serve, you know, at the heart of this. So this is one of the ways that, you know, many other countries need to interrogate and see how they might be able to adapt. And at Silent Advisory, we've been able to facilitate the Nigerian Pharmacy Council, as well as the Kenyan Pharmacy and Poisons Board, to do learning studies based on the regulatory learning group we've convened, So best practice is being shared. And the most important thing I've seen here is that if you involve me, that you said, Chiazo, remember what I said about the Francophone countries and their initial apathy towards online pharmacy. Because they're not learning from third parties like ourselves as consultants, but they're hearing from their brother regulators who wear the same kind of shoes. They are willing and prepared. And we now see countries like Benin, like Togo, who are advancing to make, these online pharmacy regulations a thing in their place, and they're getting support from their colleagues from across the continent. So that's a model that I actively encourage that countries. And recently, when I was in South Africa for the FIP conference, the registrar of the South African Pharmacy Council also indicated interest in being part of this. And we're looking to take a continental under the edges of the African CDC and the African Medicines Regulatory Harmonization, which was championed by the African Union, NEPAD. So those are some of the ways that I think we can accelerate this process and let our people benefit from improved access to care and to health products in a way that retains their dignity, their autonomy, and their safety.
Okay, thank you very much, Mr. Adesina. Very, very, fantastic illustration of a point. So I will go around the room for final words. Any additional contributions? So I'll start with you, Nomfundo.
Thank you. I think to wrap everything up from my end, I would say that the key to improving patient trust really lies in creating consent frameworks that emphasize continuous engagement rather than once-off authorization. So I think this approach helps to align both traditional African values of community consultation as well as modern data protection requirements. And like I said earlier, we really need to take those cultural and traditional values into cognizance, particularly in the space of patient consent. Thank you.
Great. Thank you very much, Nomfundo. So Carrie, over to you. Final words.
Yeah, I think understanding real-world evidence and leveraging what we know with the stakeholders in the African care system is integral in understanding digital health solutions, and we can have a significant impact on the healthcare delivery. Thank you.
Thank you very much, Carrie. Next, Rabiatu, any final thoughts?
Thank you so much. So my last word is that we have to connect each of these parts to be impactful. I'm talking about industry, about government, about our population, media to have a role to play, and civil society organization too. And I believe with this we could get this compliance. Adapting to the local context and reality. Thank you so much.
All right, thank you. So Dr. Morris, over to you.
All right, thank you, Chiazo. From my end, it will be each of the critical stakeholders understanding what their roles are. So, and by stakeholders, it will start from government. It would also be the private sector, who are the startups, the entrepreneurs themselves. It will be the universities in research and development. It will be, of course, conveners at regional blocks, at universal blocks, so the United Nations, the AUs, the Africa CDC, and so on and so forth. And of course, the civil society. This is an industry that has very huge potentials across its value chain. The potentials are there for the continent to thrive on and to grow with. The earlier we all start understanding what our responsibilities are and just really growing, the better for the continent. Thank you.
Thank you very much, Dr. Morris. And I'll hand it over to Mr. Adesina to give us his final word.
Thank you very much, first, for convening this very important conversation and bringing in very knowledgeable people to share thoughts with the rest of the world and the continent in particular. I think given the just the sheer magnitude of challenges that Africa citizens face in terms of public health outcomes. Many of the indices are poor and have been so for many years, and some are in decline. Technology remains a veritable tool to help overcome many of these challenges and improve access to care. So, as Maurice said, bringing together all stakeholders is very critical, and this is where continental bodies, institutions like the Africa CDC, the Africa Union, NEPAD, and the various regional organizations, West Africa Health Organization, and similar in other parts of the continent have to come together. There must be a willingness to embrace technology, not from the lip service point of view of saying private sector engagement, but from the co-creation that starts not just with the innovators, but also with the end users of these services. And by creating that safe environment where innovation can be responsibly introduced through technology to address Africa's challenges, I believe that 10 years down the line, as we're seeing unicorns emerging in the fintech space from Africa with the right kind of support from everyone concerned, health unicorns. We do have one from Tunisia, but this can become more mainstream through the active support of all those who need to come to the table. Thank you for having us.
Thank you very much, everyone. And I mean, just like an ancient African proverb says, if you want to go fast, you go alone. But clearly, if you want to go far, then you need to go together. And thank you for the participants for being a very fantastic audience. And I'll be handing over to Faidat.
Thank you so much, Chiaza. Unfortunately, we've run out of time for this session, so we need to jump to our next one. Thank you so much to our panelists. It was really inspiring to hear all of you, and to our participants as well. So please move on to the participants. Move on to the next session, please. Remember to
Thank you to our moderator,
Thank you,
Chiaza.
Chiaza.
Thank you for an excellent session.
That needed more than an electronic clap.
Thank you. Thank you so much. All right.
Thank you so much to all of you.
Bye, everyone. Bye.
Bye.
Thank you. Well done. Well done, Chiaza. Thanks, everyone.
Bye.
So please join the next session. Go to the conference platform at rectechafrica.adhc.com. You would see the link to join the next session right beside the name of the session, which is titled Case Study 2, Innovative Digital Healthcare Solutions, Empowering Clinical and Pharmaceutical Research in Africa. Thank you.